point. But geriatrics is the understanding, the medical understanding of a person's changes as they get older. 75 is a nice arbitrary point, but geriatrics just refers to the changes that occur as we get older. As we get older, there's certain changes that we can count on, and whether that's 75 or 65 or 55 or 85, everybody's a little bit different. Compared to young adults, the elderly have less lean body mass, which means they have an increased percentage of fat of body mass. That doesn't make any sense. We think of older people as being skinnier and losing fat, but as an overall percentage, they're actually gaining fat relative to their lean body mass. So their lean body mass is actually less, and increased fat as a percentage of body mass. And that's completely counterintuitive. They have less overall body water. They're also going to have less serum albumin levels, so they're going to have less drug binding. Because the kidney is a major organ for the clearance of drugs from the body, age-related decline of renal function is very important to keep in mind when we do drug calculations. Many drug doses must be adjusted due to declining renal function. So we'll do a creatinine clearance. It's an approximation of renal function. It's a common calculation used in pharmacology. So you read about a drug and you say, people who are over a certain age, you'll want to do a creatinine clearance and make sure that you adjust the drug dose due to declining renal function. And that doesn't just apply to elderly people, that applies to anybody who has declining renal function that we can measure on a standard blood test. And there's the calculation right there for their weight in kilograms. There's also a calculation out there for their weight in pounds. But creatinine clearance is a very important calculation to be able to do to adjust medications based on changes in renal function.